there are more than 5 signs, but normally in our program we use 5 signs. The first sign is образцов sign. It's I think it's quite hard for you to remember, but try. Another name of this sign worldwide is source sign.
Source sign.
So what should we do? First, we place our hand into the right iliac region and press. And when the patient tells us that it's painful, we stop. And then we ask patient to raise his leg. He raises his leg it's not bended in the knee, elbow. It's a knee joint, and he raises it to something like 30 centimeters, 20-30 centimeters, not very high. And during this movement, the pain increases. Why it happens, you should explain me tomorrow. It's first. It's source sign. Then another sign, which is not, there is no description in your methodical recommendation, but it's additional. I think you should remember, because it's also very it's used worldwide. It's called obturator sign.
Obturator sign.
How should Spartan sign?
Obturator. Obturator.
Operator नहीं था?
Obturator nerve. So how we check it? We ask
Sir, there is no other name for this one. There is no other name for this one, obturator sign.
There's no name. It's worldwide sign. It's it has no name. Obturator sign.
Sir, like previously in this one in Medscape, they were giving Hauschup's burger sign.
Burger?
Yes, Hauschup's.
Maybe. So, in case when the appendix goes into the pelvis and touch to the obturator nerve, in case of appendicitis, when we ask the patient to rotate his leg for medially, to prone his leg, yes, the pain increases.
Okay.
Because the irritation of this nerve. The next. Just a moment. Bartomeu Michelson.
What?
Bartomeu Michelson.
Bartomeu Michelson, please remember.
Sir, again, sir.
Bartomeu Michelson.
Bartomeu Michelson.
You'll find it. Okay. Yeah. So what we do? The same like in psoas sign. You put your hand and push, and you push till the patient tells you that it's painful.
Okay.
Then you not distract your arm and ask patient to rotate to the side. And in this position, the pain increases. Then the next sign, Razdolsky. Razdolsky was the neurologist, and he used the hammer, this neurologic hammer. But we use not hammer, we use a finger. Finger without is not percussion this way. This is just one finger percussion, like. And we found, in case of appendicitis, we find the oval-shaped zone, which located just above the appendix. It's positive Razdolsky sign.
Sir, how we differentiate like the sound, like how, like that sound is like what? Like it will be. No.
In this case, sound doesn't matter. We don't percuss because of sound. We don't hear the
pain.
sound.
Pain will happen.
Just pain.
Just pain is happening.
Percussion helps us to reveal the pain. So
Once more, please.
Once more, we make percussion, one finger percussion like this, and we found that this region is not painful, but oval-shaped region above the appendix is painful. It's positive Razdolsky sign. Then the next sign is so-called Voskresensky and
Sunday.
short, yes, short sign. So
Can you tell the name?
just short sign is better.
Short sign.
Not T-shirt, but short.
Just remember.
Because patient can have another pajama or something. T-shirt. Okay. What you do? First of all, you make tension of his cloth, and then you, with 3 fingers, you do movements. 1, 2, 3.
Why this type of?
And when your fingers goes above the appendix, there is a pain. It's a not appendix specific symptom. Why? Because this symptom can be seen because of irritation of peritoneum.
So we can also do in bare body also like this.
Not it's for women also. Why we use this? Because when there is a skin,
Yeah.
skin is not
So friction is
yes,
more there.
it can be moist, it can be not smooth surface, but and you cannot apply equal pressure to the all parts. But when you put the cloth above, you can do the equal movement for all parts of abdomen.
Yeah, patient will not sigh also.
Understand? And the last a very important symptom, it is also worldwide, is rosing sign. Rosing. How we make? We check the sign with 2 hands. First hand, we are standing near the patient, right side. Then we take our left hand and press in the left inguinal region, and we press so that push the sigmoid intestine.
Okay.
We press to jam it. Then we take our fingers and make so-called balloting palpation like this. Once again, this, and then, and patients start to feel the pain in this region. Why? When we press the sigmoid, we prevent intestinal mass and gases from going down. When we press, all gases and masses from the large intestine goes backward, and they provoke stretching of the cecum, and it disturbs the inflamed appendix. That's why that's pain.
Sir, we have to wait for 2 or 3 seconds after pressing that sigmoid. No. So like we have to wait, or like we at the same time we palpate.
It's the same.
At the same time.
So we press.
Yeah.
Then.
Okay.
Not this way.
Okay.
So only in the upper portion there where you showed us, or the whole of it?
Yes, not all.
Only the upper
You can
portion.
do this way, but classical is this, and you make pressure into the descendants, colon descendants.
Okay, sir.
Okay? So now have a seat.
Sir, my question. Okay, after this.